Good morning, everyone, to the Thursday, December 2nd media briefing by the Windsor-Essex County Health Unit. Today, we are joined by Ramsey D'Souza, our Manager of Epidemiology and Evaluation, and he will be presenting his weekly EPI summary. So take it away, Ramsey.
Thank you, Mike. Good morning, everyone, and thank you for joining us for this week's EPI summary. So let's jump right in. We'll begin with what we usually talk about with what's happening across Canada, locally in Ontario, and finally rounding up with what's happening in Windsor-Essex. So looking across Canada, we are seeing an increase in our cases, though it is incremental over the past couple of weeks. Our current 7-day average is about 2,800 cases. This is up from where we were last week, where we were seeing about 2,500 cases. Now moving on to Ontario, our case counts have increased in the province as well. It's a bit more linear than what we're seeing across Canada. The current 7-day average for Ontario is 784 cases, whereas this time last week we were seeing about 650 cases per day. When we move to Windsor-Essex, we are seeing an explosion of cases currently. Our current 7-day average is about 70 cases a day, which is almost double than where we were last week, about where we're sitting about 44 to 46 cases a day. As a result, our week-over-week rate has also increased. For our most recent completed week, our rate is over 100. It's at 113.4 cases per 100,000 population, whereas last week at this time we were at 73.8 cases per 100,000 population. For the most recent 7 days, our case rate too has increased and it's at 123, which is higher than our weekly rate for the most recent 7 days. Whereas this time last week for the most recent 7 days, we were at 74.5 cases per 100,000 population. So how do we compare to other regions in the southwestern region of Ontario and across the entire province? So our rates and the rates across the two other regions are increasing, but the rate of our increase is much greater than the other two. For the most recent completed week, we have the third highest rate, though we are eclipsed by regions in Algoma and in Temiskaming, both in Northern Ontario. And our rates in Windsor-Essex is higher, almost double in terms of what we're seeing in the province. When looking at our wastewater surveillance data as well, though we have seen a dip for big chunks of November, we are seeing an increase again. And it is a spike that we've observed in the past couple of days. When we also look at a percent positivity for our most recent week ending on November 27th, our percent positivity is 7%. This has almost doubled from where we were last week, where we were at 4.8 to 4.5%. Once again, looking at the most recent 7 days and comparing ourselves to other regions in the province, we have the fourth highest percent positivity, sitting at 5%, whereas in the province overall, we're sitting at 2.8%. We do have lower rates though compared to Hull and Norfolk, Southwestern Ontario, Public Health, and also in Temiskaming. Breaking down our percent positivity by age, as you'll see in the most across all of our age groups, we are seeing an increase. And specifically, the highest percent positivity right now for the most recent 7 days is among those 35 to 64 and 18 to 34 years of age at 9% and 7.5% respectively. So for the 35 to 64 year age group, almost 1 in 10 test results for this age group is coming back as positive. Looking at November onwards for our rates by municipality, the highest rate for each municipality is in Leamington, followed by Amherstburg, and then Tecumseh. Strictly looking at the distribution of cases for the most recent 30 days from November 1st to November 30th, 46% of our cases are from the city of Windsor, 12% from Leamington, and there is an equal distribution amongst all the other regions locally. In the most recent 7 days, however, just like the last slide, we are seeing an increase in Leamington in terms of cases. Windsor continues to have the highest distribution of cases, and then as well, the other municipalities have their own equal distribution with regards to cases. So now looking at our age and sex breakdown, we continue to see a high number of cases among our 0 to 19, and we are seeing slight increases across our older age groups between 30 to 79, though it is a slight increase in the past couple of weeks. And then looking at how our cases are acquiring COVID-19, just under a third of the cases are acquiring from a source that they aren't able to identify. Almost 30% are acquiring it from their household contacts, and about 20% of cases are acquiring it from a close contact that's not part of the household, whether it be at work or at school or in other settings. So looking at schools specifically, just like with our overall case count in the region, our school-related cases and our 7-day averages are also increasing. We are currently just below levels that we experienced towards the end of August and in September of this year, where our numbers were really high. So we're currently sitting at just at 15 cases a day in terms of school-aged children acquiring COVID-19. When we compare our 7-day average for our school-aged children across our entire population, they're both increasing, but the distribution, though, in terms of increases is much higher in our school-aged children than in our overall population. Now, moving on to our hospitalizations in Ontario have remained fairly unchanged, though we have seen some fluctuations, and the same can be true for what we're seeing in Windsor-Essex as well. When we look at our ICU numbers, however, ICU numbers in the province have started to increase in this past week. In Windsor-Essex, our numbers are increasing as well. We have currently surpassed what we've seen for most parts in our fourth wave locally. Now, looking at our overall cases for the past week, from November 22nd to November 28th, the rate of those unvaccinated versus fully vaccinated is higher among those who have acquired COVID-19. The relative risk between these two groups is 3.4, meaning unvaccinated cases are 3.4 times more likely to acquire COVID-19 compared to those fully vaccinated. If we look at those patients in the inpatient unit across our hospitals for this most recent completed week, our relative risk is 6, meaning unvaccinated cases are 6 times more likely to be hospitalized for COVID-19 compared to those fully vaccinated. And then once again, with our ICU numbers for the past week, the relative risk is 4.8, meaning unvaccinated cases are 4.8 times more likely to be hospitalized in the ICU for COVID-19 compared to those fully vaccinated. Now, revisiting our doubling time, our doubling time has decreased across the board, whether it's Ontario, Windsor-Essex, and in Canada, though we're seeing a greater decline, which means an increase in the burden of COVID in Windsor-Essex especially. So what is our most recent R0? The most recent estimated median R0 is 1.34. This is higher than where we were last week, where we were at 1.1. So when the R0 is greater than 1, each infection leads to more than one new infection, signaling an increase in our cases. Now, moving on to our vaccine status. This slide looks at our first, second, and third dose administered from October 1st onwards. We are seeing an increase in third dose administration and also in our first dose administrations found in the dark blue line and in the orange line. These are primarily driven by what we're seeing within our 5 to 11 age group that's now eligible, and also increased eligibility in our third dose population as well. When we look at our first dose coverage rate by age groups, you'll see the inclusion of the 5 to 11 age group. They're currently at 12.8%, but this is they're a day old. So currently, as of yesterday, last night, they will be at just approximately over 14%. Our overall coverage rate in Windsor-Essex across all individuals, even those who are not eligible, such as those 0 to 4, is currently at 77.2%, found in the orange bar. Looking at a fully vaccinated coverage rate groups by age, you'll notice that the 5 to 11s are 0 because they're not eligible just yet. But looking at across all the eligible groups, 5 plus, the rate is 77.0% in terms of those fully vaccinated, and across our entire population locally in Windsor-Essex, we're 73.5% for those fully vaccinated. Just like in the previous weeks, there are some regions in the province, locally, that have lower first dose coverage rates. This is specifically in the N9A and the NOP postal codes, and in those regions the coverage rates for first doses are lower than what we're seeing in our overall population. The same can be true as well for what we're seeing in our fully vaccinated populations as well. So how do we compare ourselves now that we're looking at our residents 5 plus with at least 1 dose? Our first dose coverage rates, 5 plus, in terms of where we are in the province, we are on the lower end. Though if you look at the health units that in the middle of the pack, we are fairly close to them. So we're not too far off, and we are seeing improvements and an uptake in our 5-11 age group, which should boost our numbers in the upcoming week. For second doses, we continue to be in the bottom end. This was true as well when we only looked at our 12 plus population, and it remains fairly unchanged. So in summary, our case rates in Windsor-Essex has increased this past week. Wastewater surveillance 2 has indicated that we are seeing increased levels of COVID-19. Children, especially school-age children, continue to have a disproportionately higher case counts compared to the entire population. COVID-related hospitalizations has remained unchanged relatively, but ICU admissions have increased. We are seeing an increase in dose administrations, but that's primarily tied to 5 to 11s and those eligible for third dose boosters. And when reviewing our monitoring indicators, for our most recent completed week, our case rate is at 113.4 cases per 100,000 population. And the most recent 7 days, it's at 123.1 cases per 100,000 population. Our full completed weeks percent positivity is 7%. And in the most recent 7 days, it's at 5.4%. Our R0 is above 1 at 1.34. Outbreaks continue to remain high in our region. As of today, it's above 30. And our fully vaccinated coverage rate for 5 plus for the first dose, for fully vaccinated is at 77%, and for at least 1 dose is at 80.9%. Thank you, everyone.
Thank you, Ramsey. We'll now take questions from the media. Today we'll start with CBC.
Good morning, thank you. Maybe Mr. D'Souza, could you remind me which age group has the lowest vaccination rate at this point? Any insights as to maybe why it might be a little lower there?
In terms of eligibility, the current lowest one is 5 to 11s, but if you're looking at historical numbers for those not eligible, it continues to be those below 30. So specifically the 18 to 29 year age group. And in terms of insights, there could be various reasons, but in terms of what we're seeing, they range for concerns in terms of why, efficacy and safety of the vaccine. But in terms of for our concerns, we don't have specific ones in terms of what we're seeing. Maybe our RM agency could then provide some more information.
Oh, Shankar,
okay, that's all for me. Thank you.
Dr. Nazathouri, did you have a comment?
So I'm not sure we have any empirical data to understand why vaccination rates fluctuate. The one thing I think of is that it's the nature of young people to feel perhaps not unusual for young people to not take things in the same context as older people. Young people are less likely to suffer adversely than older residents. So I think that there are probably a number of factors that are psychosocial in nature, but they're not well elucidated, at least from my understanding of the literature.
Thank you very much.
Okay. We'll now move on to the Windsor Star.
Yes, good morning. Ramsey, thank you for your presentation. Based on what you're seeing in the data, could we experience numbers as high as we did last December and January? We already have more active cases now than we did this time last year.
It is possible. A lot more things are open now than when we were last year. We're seeing increased capacities, not increased, but gatherings as well. Whether it's social events or things like weddings as well happening. So it is possible. I think that some last year case counts were higher now than where we were. So there are concerns. We've also seen a higher number of dismissals happening in our schools as well. So all those factors could potentially drive our numbers up. But in the end, it does fall on all of us as a community to follow the measures and be more vigilant with our practices as well.
Yeah, if I could supplement that, I think we are very concerned about the rates going up and equaling or surpassing previous rates. We're already at a rate of activity as quantified by case counts that's greater now than early September. I think Ramsey can correct me on that, but so we definitely have an uptick in the number of cases. The other thing is the number of people hospitalized, and Ramsey can correct me again, I think is 20 in Windsor-Essex, 23 in Windsor-Essex, and we've had some recent deaths, Ramsey, too. Is that correct?
2 today, that's right.
Yeah. So we have an increase in disease activity, and the burden of disease is probably causing some strain on some additional strain on the healthcare system.
I suppose, what difference do you, and this is a prediction, so I'm sorry for that, what difference do you predict the vaccine's presence might make? Because we did not have any vaccine coverage around Christmas last year. That was just before when it was beginning to roll out.
Yeah, I think that we know that on an individual level, if you get vaccinated, you're less likely to get sick, you're less likely to go to the hospital, you're less likely to die if you get COVID. And that has implications for the people that are vaccinated. So I would, ask every person who's in their 50s and 60s who's currently not vaccinated and eligible for the vaccine to get the vaccine. We've seen deaths among people living in the community, and I think approximately 475 people in this health district have died of COVID. The vaccine will make a difference also to the extent that if you do get COVID, you're not going to if you're less likely to go to the hospital, you're less likely to use or utilize ICU resources. So we do think the vaccine has had an effect on both an individual level and on a population health level. At this point, most of the hospitalizations and ICU admissions and deaths are among the unvaccinated. And the people doing the disproportionate amount of work to try for containment are children in schools. And so to that extent, I think the burden, vaccination has diminished the burden, but we still have a long ways to go to bring this under control. The other thing is our goal is to try our very best to keep schools open for instruction. And I think that still remains a goal in these next few months. And we need to get the vaccination rate of children up so that will be more likely to keep schools open, even if case counts increase in the community.
And Doctor, finally, with that goal in mind of keeping children in schools for in-person learning, at this point, would you like to see the province maybe reintroduce any restrictions that they had previously to stop further spread, stop the exponential growth from happening again this Christmas?
Yeah, the province has experts and they make provincial policy, and we do advise them privately, and I will continue to do that. We also have the discretion of the local health district, depending on the burden of disease, of bringing forth additional public health measures to control COVID. The Board of Health has taken a leadership position in vaccination and passed a resolution, or passed if resolution is the right characterization, requesting the province add COVID vaccination to the Immunization for School Pupils Act, which would be one more step in trying to get the vaccination rates higher. I would urge the province to take the guidance of the Board of Health to include COVID vaccination in the Immunization for School Pupils Act. In this province, it's one of the areas of leadership is that we've had an organized system to vaccinate young people well before COVID. And right now, I think one of the biggest risks for interrupting school are cases being exposed or people being exposed to COVID in schools. I want to share with you that I think at this point, and Ramsey can correct me on the numbers, but we're about 600 cohorts of young people have been dismissed from schools. That means approximately 12,000 children have been excluded from school for some period of time to help contain COVID. The primary beneficiaries of their exclusions are not them. The primary beneficiaries are the people that these children are helped by breaking the chain of transmission. So I think we have a long way to go, and we have some levers to pull, but the Immunization for School Pupils Act is one more lever, or one more a public health measure that we can effectuate to try to control COVID in Windsor-Essex.
Thank you.
Any questions from AM 800?
Ramsey, just going back to the stat you mentioned in regards to school-age children, we're seeing, I believe you said 15 cases a day right now. Is that higher than what we saw, I guess, this time last year?
Yeah, because this time last year we were seeing an increase, but the majority of the increase happened towards the middle of December and then later in December as well.
Okay, just looking at my notes, the other stat that caught my eye, you mentioned almost 1 in 10 for the age group of 35 to 64 in the past 7 days are the new cases. Within those individuals, vaccinated, unvaccinated, one dose, do you have any information there?
Not readily available, but in terms of what we're seeing, or in terms of our overall cases, the rates for those unvaccinated is higher than those fully vaccinated. So across our entire population, we're seeing, though we have a smaller number of individuals who are unvaccinated, they do make up the bulk of our cases.
And then Nicole, sorry, throwing one at you, but in regards to enforcement, I know Doctor mentioned it yesterday about enforcement and asking businesses about the vaccination status and showing the proof of vaccination. How is enforcement going these days? Are businesses complying, individuals complying?
Yeah, overall, I would say we're not alarmed by the compliance. So our officers are still out. We do, issue tickets and notices of what we call notices of violation. So, but it's a spectrum of things. But overall, I wouldn't say we're seeing an alarming, anything alarming around compliance. Again, a lot of the education does tend to focus. It's actually less around proof of vaccination and more around PPE use, so masking and distancing and things like that within public settings.
Thank you.
And any questions from CTV?
Yes, good morning. Last year, the province had thresholds for key indicators to determine restrictions. This year, it's a different situation, but are there any local thresholds to pull those levers that you were mentioning?
Well, we do try to look at this at a fulsome level. I think there are many metrics that would determine or if one would have to consider. The number of cases is an important metric, but it's not the only metric. The other metric to think about is the R naught number, meaning that if one person's infected today, how many people will they infect as a result of that infection? I think another variable to look at is the number of outbreaks and the number of school dismissals. And importantly, the number of people currently in the hospital and the number of people in the ICU. And pulling those all together, I think we would try to make a determination. We also have to consider the regional context, is that we're not an island in Windsor-Essex relative to adjacent health districts. We don't have a clear numerical threshold, and I'm not sure a numerical threshold is the right approach because all those variables are interacting with each other. But we do continue to evaluate the data, and I think it's fair to say we're all very concerned at the Public Health Service about this increasing number of cases, especially as the holidays come forth and there'll be more human-to-human interaction.
Okay, thank you. And about the vaccine supply, what is the local vaccine supply with the anticipated announcement from the province that eligibility for boosters for 50 plus could be opening up soon?
So I don't have the exact number of, the number of vaccines that we have on hand. If that's what you're asking, we could certainly get that to you. But I guess probably to answer your question, we don't have any concern around our vaccine supply, and certainly anytime the province announces new groups that are eligible, there's a lot of preparation that goes into that, and we have a really good system for receiving and ordering our vaccines. So we'll be ready as we always are, and there's certainly no concern from a supply issue on that, from our perspective.
Okay, thank you.
Thank you, everyone. That's all the time that we have for today. So we will see you again on Monday, December 6th at 8:30. Thank you and have a great weekend.
All the best.